thyroglobulin by endocytosis. Then the next step is that thyroglobulin with its coupled miTs and diTs is brought into contact with lysosome in the cell interior. Then the next step is that the proteolysis of thyroglobulin releases T3 and T4, which then diffuses out of the follicular cells into the interstitial fluids and from there back into the blood. So what are the controls of thyroid function? Essentially, all of the action of the follicular cells are stimulated by thyroid stimulating hormone or TSH, which is stimulated by thyrotropin releasing hormone TRH. The basic control mechanism of TSH production is the negative feedback action of TH on the anterior pituitary and to the lesser extent the hypothalamus. TSH not only stimulates T3 and T4 production, but it also increases protein synthesis in follicular cells, increases DNA replication and cell division, increases the amount of rough endoplasmic reticulum and other cellular machinery required by follicular cells for protein synthesis. When TSH levels exceeds normalcy in the thyroid cell, it undergoes hypertrophy. This causes the cell to increase in size. Enlarged thyroid gland from any cause is called a goiter. Now we have the TSH, TRH thyroid hormone sequence. Then it goes to the neural output. Then it goes to hypothalamus, which it increases the TRH secretion. Then it increases the plasma TRH in hypothalamo-pituitary portal vessel. Then it increases the TSH secretion, which is the anterior pituitary. Then it increases again into plasma TSH. After that, it increases again it goes to the thyroid gland, which increases the thyroid hormone secretion, the T3 and T4, which then it goes to the plasma thyroid hormone, increases again. Then the target cell for thyroid hormone T4 converted to T3 responds to increased T3. So action of thyroid hormone. Thyroid hormone receptors are present in the nuclei of most cells of the body. Unlike receptors for many other hormones whose distribution is more limited, thus the action of T3 and T4 are widespread and may affect many organs and tissue. Actions of thyroid hormones. There are three main actions of thyroid hormones. We have the metabolic action, permissive action, and growth and development. In the metabolic action, thyroid hormones have several effects on carbohydrates and lipid metabolism, although not to the extent of other hormones, example insulin. However, thyroid hormone stimulates carbohydrates absorption from the small intestine and increases fatty acid releases from the adipocytes. This action provides energy to maintain metabolic rate at a high level and are consistent with one of the major actions of thyroid hormone, which is to stimulate the activity of sodium, potassium, and ATPase throughout the body. ATP is consumed by sodium slash potassium plus ATPase at a high rate due to thyroid hormone activation. The cellular stores of ATP must be maintained by increased metabolism of fuel. The calorogenic action of TH represents a significant fraction of the total heat produced each day in a typical human. Now let's go with the permissive action. Many of the action of thyroid hormones are attributable to its permissive effects on catecholamines. The thyroid hormones upregulates beta adrenergic receptors in many tissues such as the heart, nervous system, which increased levels of thyroid hormones potentiate the action of the catecholamines, even though the catecholamines are within the normal level. Growth and development. Thyroid hormone is needed for normal production of growth hormone. Therefore, in the absence of thyroid hormone, growth in children is decreased. Thyroid hormone is one of the most important. This is now the growth and development the function, which it starts with that thyrosin is needed for normal production of growth hormone. So the developmental hormones for the thyroid hormone is one of the most important developmental hormones for the nervous system. Absence of thyroid hormones during fetal life results in poorly developed nervous system and a form of mental retardation called cretinism. Now let's go with the cortisol. Its physiological function of cortisol and its function of cortisol in stress. So I think it's stress. So what is cortisol? Cortisol is a steroid hormone. It is produced when there isn't enough cortisol in the blood to maintain homeostasis in the body or to deal with stress. It is produced by the adrenal gland. When the body needs cortisol, a message is sent to the hypothalamus via the sympathetic nervous system to produce the hormone CRF. The CRF activates the pituitary gland, which then produces the hormone ACTH. This in turn alerts the adrenal gland, which stimulates the adrenal cortex to produce cortisol. Stress response. So, the physiological function of cortisol. Basal cortisol level may help maintain normal blood pressure. Cortisol exerts influence on the reactivity to epinephrine and norepinephrine of muscle cells that surrounds blood vessels. Basal level of cortisol are also essential in maintaining cellular concentration of certain enzymes involved in metabolic homeostasis. Cortisol also serves as an anti-inflammatory agent and also has anti-immune function. The anti-inflammatory is that the cortisol inhibits the production of both leukotrienes and prostaglandins. Leukotrienes and prostaglandins are both involved in inflammation. Cortisol also stabilizes lysosomal membrane in damaged cells, preventing the release of their proteolytic contents. Cortisol reduces capillary permeability in injured areas, thus reducing fluid leakage to the interstitium. Anti-immune, which is the cortisol, suppresses the growth and function of key immune cells. The importance of this is that if cortisol was absent, the body would overreact to minor infection and autoimmune diseases can result. It, in essence, acts as a brake on the immune system. Cortisol is also important during fetal and neonatal life. It serves to allow for proper differentiation of numerous tissues and glands, including various parts of the brain, the adrenal medulla, the intestine, and most notably the lungs. Cortisol produces surfactant which reduces tension in the lungs. Function of cortisol in stress. So, the effects of organic metabolism. So, stimulation of protein catabolism in bone, muscle, and elsewhere. Stimulation of liver uptake of amino acids and their conversion to glucose or the gluconeogenesis. Maintenance of plasma glucose level and stimulation of triglyceride catabolism in adipose tissue with releases of glycerol and fatty acid in the bloods, and that's the effect of the organic metabolism. Inhibition of inflammation and specific immune responses. It broods the inhibition of non-essential functions. So that's all resources can be put towards dealing with the surfactants, stimulation. So let's move on. So it enhances the function also of the cortisol, that it enhances vascular reactivity, which increases the ability to maintain vasoconstriction in response to norepinephrine and other stimuli, so that the body can engage in fight and flight response. Now let's talk about the disease and psychological stress. There are several endocrine system diseases that results from disruption in the complex system. Some are as follows. They have the adrenal insufficiency or the Addison's disease. They have the Cushing's syndrome, diabetes mellitus, growth disorder, and thyroid disorder. So what is adrenal insufficiency? So adrenal insufficiency is an endocrine or hormonal disorder that occurs when the adrenal gland do not produce enough of certain hormones. It refers to any situation in which the level of cortisol and chronically lowers than normal. There are two types of adrenal insufficiency. We have the secondary, we have the primary, and the secondary adrenal insufficiency. Let's recall the production of cortisol. The cortisol is produced by the hypothalamus, which secretes the CRH, which goes to the ACTH, the pituitary gland. Then it goes to the cortisol in the adrenal gland. It regulates the glucose level, increases the fat in the body, helps to defend the body against infection, and helps the body respond to stress. So the primary adrenal insufficiency, also referred to as the Addison's disease, occurs when the adrenal gland are damaged and cannot produce enough of the hormone cortisol and often the hormone aldosterone. So what are the causes of Addison's disease? The most common cause is due to the autoimmune attack, in which immune system mistakenly recognize some component of a person's own adrenal cells as foreign. It is due to loss of adrenal cortical function, which may occur, for example, when an infectious disease such as tuberculosis, HIV, or fungal infection infiltrate in the adrenal gland and destroy them. Then we have the tumors. The system of it is that imbalance of sodium, potassium, and water in the blood. It has the hypotension or the low blood pressure, chronic diarrhea, darkening of the skin, patchy skin color, paleness, extreme weakness, fatigue, loss of appetite, and mouth lesion on the inside of a cheek or buccal mucosa. It also has the symptoms of nausea and vomiting, slow or sluggish movement, and unintentionally weight loss and salt craving. So yeah, it's scary actually if the primary adrenal insufficiency or Addison's disease. So how is Addison's disease diagnosed? The diagnosis is made by measuring plasma concentration of cortisol. Tests may also show increased potassium levels, low blood pressure, low serum sodium. However, sex hormones will be at normal levels. Addison's disease may be diagnosed as chronic fatigue syndrome or even as a physiological disorder because some patients may exhibit anxiety or emotional problem. The treatment? This disease requires daily oral administration of glucocorticoids and mineral corticoids. Also, the patient must carefully monitor his or her diet to ensure adequate consumption of carbohydrates and control potassium and sodium intakes. Secondary adrenal insufficiency. Now let's talk about the secondary adrenal insufficiency. The secondary adrenal insufficiency can be traced to a lack of adenocorticotropic hormone or ACTH, or the aldosterone production is usually not affected. So what is ACTH? ACTH is a polypeptide tropic hormone produced and secreted by the anterior pituitary gland and it is produced in response to biological stress. Its principal effects are increased production and release corticosteroid and, as the name suggests, cortisol from the adrenal cortex. Causes. A temporary form of this disease may occur in a person who has been taking a synthetic glucocorticoid hormone for a long time and then stops either abruptly or gradually. Glucocorticoids blocks the release of both ACTH and CRH. Another cause is the surgical removal of the non-cancerous ACTH producing tumors of the pituitary gland that causes Cushing disease. So what are things to remember actually? So the things to remember is that adrenal insufficiency is a disorder that occurs when the adrenal gland do not produce enough of the hormone cortisol. Primary adrenal insufficiency, also called Addison's disease, occurs when the adrenal glands are damaged and cannot produce enough of the hormones cortisol and often the hormone aldosterone. While the secondary adrenal insufficiency occurs when the pituitary gland fails to produce enough ACTH, a hormone that stimulates the adrenal to produce cortisol. If ACTH output is too low, cortisol production drops. You have the Cushing syndrome. Cushing syndrome is a hormonal disorder caused by prolonged exposure of the body's tissue to high level of the hormone cortisol in the blood, even in a non-stressed individual. The causes of the Cushing syndrome is that due